very nice to meet you. I believe you were my eye exam appointment for today. Yes. If I can just get your full name before we get started. Okay. There you are. Fantastic. We'll just be getting started with what it says a traditional eye exam. Do you have any questions before we get started? Any concerns? No. I wouldn't be nervous. It's a very simple, quick examination. Perfect. Okay, so I have your file pulled up here, and we're just going to update a few questions. Before we get started, have you had any medication prescribed to you in the last year? No. Okay. Are you currently taking any medications, whether it's for your eyes, anything else? It could be over-the-counter medications as well. Okay, and from what I can see, it looks like you have a little bit of a redness in your eyes and around the eyes. Have you experienced any discomfort lately pertaining to your eyes? You have. Okay. Is the redness what brought you to making this appointment? Okay. No, it doesn't look too serious. I'm sure it's something we can definitely get fixed. We get redness almost all the time here, especially with a lot of blue light coming in from a lot of our devices, computers, cell phones, things like that. Okay. And are you wearing any reading glasses at the moment? Do you have contacts? Anything to help with your vision? And it says your last eye exam here was over a year ago, is that correct? That's no problem. We do recommend seeing an eye doctor every 5 to 6 months. It really varies from patient to patient, but we would say that, if you're a glasses wearer, you should be checking in with your optometrist every now and then. But it looks like since you don't wear any glasses, you should be fine. It's just the irritation that seems to be bothering you. Okay. Well, I don't have any more questions at the time. Got everything set. Do you happen to have any more for me? You're still good. Okay. Well, we're going to start with is a very simple muscle test. I'm going to be putting pressure around your eye. Okay? Mainly on your upper cheekbone. Won't be touching too much of the sensitive area in your eye, but I just need you to look completely straight and follow my lead, and if you feel any discomfort whatsoever, just let me know. Okay, perfect. Okay, so we're just going to start with the cheekbones here. Feels good. Alright. Any pain when I put pressure on this side here? Okay. Just move up top. Okay. No discomfort? A little bit here. Okay, so around near the temple. No, it's perfectly normal. As I said before, the redness on the outside of the eyes, I saw a little bit more coming from the temple. So when you sleep, do you happen to be allergic to anything you may be laying your head on? How often do you wash your sheets, your pillowcases? Now, that skin irritation can come from that, or it can be much deeper eye infection, but I don't believe it's anything too serious to worry about. But you should be fine here. Okay. Now I'm just going to need you to close your eyes for me. We're just going to be putting a little bit of pressure on your eyes, like so, just to test out the muscles behind your eye Make sure there's nothing obstructing your view in any way. You just please let me know if you feel any pain whatsoever. Okay, just go ahead and close your eyes for me. Perfect. Just a little bit of pressure. Shouldn't be too painful. Okay. You feel any pain when I push pressure from the sides? No pain. We're going to go up. Okay. And push down. Okay. No pain. That's good. That's good. Now, without moving your head, I'm just going to have you look with your pupils. Okay? So, let's go ahead and look up as high as you can for me. Perfect. Perfect. Okay, let's have you look down. Okay, don't move your head. Just keep it straight. Perfect. And look that way. Your right, my left. Okay? Now my right, your left. Perfect. Alright. That seems to be fairly normal, which is good. You want to make sure that we get the basics down first before we really go in depth and look at your pupils. So far, just a little bit of discomfort on that temple. Looks like it's your right temple. Everything else is performing fairly normal. Okay. Now, I'm just going to have you follow my finger. Again, do not move your head. Keep it straight ahead. Okay? Just follow my finger. Perfect. Just like that. Okay. Just the tip, right up here. Now, are you experiencing any blurry vision? Some motion blur, perhaps, when moving with just the eyes? Okay. Continue. Okay. So not much blurry vision. That's good. Your pupils seem to be reacting nice with each other. They're very in sync with each other. We do have some patients here where one pupil may dilate sooner rather than the other one. One can be more reactive than the other one, but it seems like both of your eyes are doing just fine. Just good. It's just a little bit of red irritation, which I can definitely prescribe something at the end. Okay. Of course. Alright. Now we're just going to test your peripherals here. Okay? I'm going to need you to look straight ahead. You can look at my nose. You can look at my eyes. You can look directly behind me, but I just need you to look straight ahead. Alright. I am going to be bringing my fingers in from the side, and you let me know which side wiggles. Okay? It could be this side, it could be that side, it could be over here, be over there. It can be both. You just let me know what you see. Okay, fantastic. Straight ahead. Okay. Perfect. Fantastic. Okay. Okay. Good job. Couple more. Okay. Perfect. Alright. That was done very nicely. You got the majority of them right, which is fantastic. That's what we like to see here. Did you experience any discomfort straining your eyes, perhaps, and trying to focus on your peripherals? Not much. Okay. Alright, now we're going to be testing your pupils. Just any discoloration, perhaps, or any, defects in any way whatsoever. I am going to be shining this light here into your eye. I apologize in advance because it is a blue light. It's made to stimulate your senses. But we're just going to go ahead and see if your pupil relax. So, straight ahead. Alright. That's good. That's good. Okay. Just seeing how both your pupils react. Again, do you just feel like a skin pain here, or do you feel like there's a deeper pressure on this side? More of a deeper pressure. Okay, here. Because I am noticing this eye here seems to be a bit more irritated than the others. Okay. That's fine. Okay, so that's enough for the light for now. What I'm going to have you do is I'm going to have you cover your eye and look back at our helpful sign over here. Okay? We usually use these for the kids, so sorry if it's a little weird, but this is our little buddy. We like to use them to cover each eye when examining, so I'm going to hand this to you, or would you like me to do it for you? Okay. No problem, no problem. So I'm just going to have you stand exactly where you are, and just right behind that line right there. Perfect. And I'm going to have you just read off the first line, second line. Just follow my instructions, okay? Okay, so here you go. We're going to cover this eye. And I'm going to have you start with line 2. Okay. Let's go line 4. Okay. You got it. Perfect. All right. Line 4 once more, please. No, it's no problem. No worries. And let's move on down to line 6. You think you could handle line 8 for me? Just line 8. Very good, very good. And we're really going to test you here. Go ahead and give me the final line. Line 11. Okay, really good, really good. How do you feel you did? You feel like you did well. Okay. Well, we're going to have the results to the final exam towards the end here, but I really just am concerned with the pressure you said you felt on this side here, so it doesn't look like this one's very reactant. It's more on this side here, and the redness. Do you sit in front of a computer for a long amount of time, perhaps use your phone, smartphone? You're on your phone a lot. Okay. It's completely normal. So most tech companies have actually introduced a warm night mode, because really it's just the blue light that can hurt your eyes. There's a nice warm tone to an image on your phone. It's not as strenuous on your eyes, because I can tell the redness around your eye can be from anything from video games, perhaps to just staring at a phone. You mind just bringing out your phone for me, actually? Yeah. I can help you activate it whenever you'd like. There's useful settings where you can actually set a certain time to turn on your night mode screen. Yeah. It's very, very helpful. So I would say, do you usually keep your phone at this distance? I usually have it pretty close. Yeah. Now, are you using your phone before sleep? Yeah, we all do. Even if you have all your lights shut off, it's very dark. It can be very strenuous on your eyes to have just the blue light. It's almost the same thing as having a flashlight turned on directly into your eyes when everything else is darkened. So it can really bring an effect to your vision. It can be dangerous, yeah. So I would recommend looking into night mode on your phone. But most importantly, turning the brightness down, keeping the phone farther from your face. But most importantly, I'm going to prescribe you these eye drops here. They are our Opcon A eye drops. They're for eye allergy relief, redness, swelling, anything from itching, to the works. You know, it's a very basic formula. It isn't too strong, so it's good something to start with. If you feel more pain or see the redness continue, then you can always come back and we can prescribe you something a little bit stronger. Okay, but I'm going to go ahead and give this to you. We'll put it in your bag of goodies. I'm going to have you take 3 drops daily. Okay, whenever those drops, whenever you'd like to put them in, it's up to you, but we do recommend before bed or waking up. So you could put a drop in the morning, 2 drops before bed, 2 drops in the morning, 1 drop at night, just as long as your eyes are getting the proper moisture that they do recommend here. Now, I mean, as much as I'd like to recommend not sitting in front of a computer all day, I can't necessarily tell you to not use your phone or not be on the computer, but definitely limiting screen time can help you. Screen time is a huge factor in putting strain on your eyes. If I were here and I just stared into a flashlight for 10 hours straight, then it would definitely have an effect on my eyes, but I know it's smarter to kind of put the computer away, put the phone down, relax, make sure you're getting enough sleep. The bags under your eyes, I noticed, are taking effect as well, so proper sleep and proper hydration can very much help. Now, to finish off the redness you have right here, is that from perhaps a moisturizer you use? Do you have any cleansers? You recently switched to a new moisturizer. Okay, well, I'm not seeing any more irritation anywhere but the temple. Do you sleep on this side? Okay. And you said it's a little bit of a pressure pain, not too strenuous. Okay. Well, with that, I'm going to go ahead and prescribe you a moisturizing cream. Just to help bring down the redness. Some swelling seems to be going around your eye here as well, so I would say that the moisturizing cream I'm going to prescribe, have you go down to the pharmacy and have you see Deborah. So here's your final paperwork. I'm going to have you take that and make sure you see Deborah at the pharmacy. Oh yeah, she'll have your eye drops over there. This Opcom is actually my own Opcom that I have. I use about 4 drops every day. Yeah, I'd like to start you on 3 though. Okay. Of course. Everything seemed to come out very well. I expected it to go fantastic for you, so I'm actually really happy with this outcome. I would say, if anything, stay away from the phone, stay away from the computer. Use the moisturizing cream and the eye drops daily, please. And again, if you feel any more pain or see the redness consist, come on back and we'll help you out, okay? Of course. Oh, thank you very much. I greatly appreciate it. Oh, well, you can always give us a review on Yelp. That usually helps out. Alrighty. Well, have a wonderful day. Thank you for stopping by. And please, don't forget to smile. Okay. Bye-bye now.